About 2,500 years ago, Hippocrates made noteworthy observations about the influence of climate on public health. He believed that people living in cities with different climate may suffer from different diseases. Hippocrates also observed that abrupt climatic changes or unusual weather conditions affect public health, especially the incidence and severity of various infectious diseases, including gastrointestinal infections, tuberculosis, and central nervous system infections. Throughout history, infectious diarrhea has been associated with crowding, poor sanitation, and war. Although descriptions of infectious diarrhea exist in the earliest records of civilization, effective measures for prevention were not widely or consistently used until the modern era of active public health promotion. Advances in understanding of etiologies and therapies have revolutionized prognosis.
Diarrhea means an increased frequency or decreased consistency of bowel movements. Diarrhea occurs because more fluid passes through the colon than what the organ should absorb. There are many causes, but diarrhea often is caused by an infection of a bacteria, a virus, or a parasite. A consequence would be dehydration of diarrhea. Signs of dehydration include decreased urination, lethargy, poor skin tone, and generalized weakness. Gastritis is an inflammation of the stomach lining. The lining of the stomach often looks red, irritated, and swollen, and it might have raw areas that can bleed. Some of causes for getting gastritis would be that person has an infection with Helicobacter pylori, a viral infection, and chemical or environmental irritants. Consequences from getting gastritis are that you get awakened from sleep, prevent you from eating, or interfering with your normal school or work duties. A stomach ulcer is a small hole in the gastrointestinal tract. Ulcers that form in the stomach are called gastric ulcers. An ulcer is normally not contagious or cancerous. Causes for an ulcer can come from an infection with Helicobacter pylori, specific medications, or even cancer. The consequences for having an ulcer is that you can get your stomach wall damaged or even till it bleeds. And that can lead to a surgery.
Treatments for the digestive diseases. How are ulcers treated? If not properly treated, ulcers can lead to serious health problems. There are several ways in which ulcers can be treated, including making changes to one's lifestyle, limiting diarrhea, taking medication, and/or undergoing surgery. Lifestyle changes to treat an ulcer. To treat an ulcer, first eliminate substances that can be causing the ulcers. If you smoke or drink alcohol, stop. If the ulcer is believed to be caused by the US NSAIDs, they need to be stopped. Now, the ulcer medication. Proton pump inhibitors, antibiotics, upper endoscopy, and surgery. Diarrhea. Give a child or adult plenty of clear fluid like water, Pedialyte, Ceralate, or Infalate. Fruit juices and sport drinks should be watered down to 1/2 strength. Avoid milk and milk-based products. Give an infant frequent sips of water so they can hydrate and recuperate from the dehydration that they will suffer from the diarrhea. And finally, treatment for gastritis. Taking antacids and other drugs to reduce stomach acid, which causes further irritations to inflamed areas, helps. Avoiding hot and spicy foods, and also for gastritis caused by H. pylori infection, your doctor will prescribe a regimen of several antibiotics plus an acid-blocking drug. If the gastritis is caused by pernicious anemia, B12, vitamin shots will be given. Eliminating irritating foods from your diet, such as lactose from dairy or gluten from wheat, also works.
The next disease that we're going to talk about prevention is gastritis. And how to prevent it? Well, avoid fast foods, avoid large consumptions of alcohol, also avoid chewing gum, because when you chew gum, unnecessarily gastric juice is produced when you're actually not eating anything, and that can burn your stomach. And also keep a healthy weight, reduce stress like exercising, and Avoid drinking coffee or soda. Now we're going to talk about how to avoid getting diarrhea. There are many ways to avoid this, and some of them we're gonna explain it right now. And first one is to try to drink only bottled water, because water from the faucet can be dirty. And never eat raw or undercooked meat or seafood. And this is the most important one. Always wash your hands, especially after you go to the bathroom. And avoid eating food sold in the streets, especially ice cream that can be made with tap water. Now we're going to talk about how to prevent these diseases we have been talking about in this video. And the first one is the ulcers. And how to prevent them? Well, we have to avoid eating spicy and fatty foods, and don't smoke. Avoid drinking a lot of alcohol or consuming drugs. And last is controlling your stress and making exercise for relaxing, and that helps you to stay relaxed and avoid stress.